Okay, welcome back. We're ready to actually go through this now. You saw an introduction explaining the logistics of the room and why we're doing it the way we are. If you did not see that first, some of this might not make sense, so I recommend that you go back and take a look at the first link that you received. Okay, now, as per usual, step one is that you're going to verify the physician's order for accuracy, and we're going to do that. You'll choose the patient's chart, and you'll go in and choose the IV solution and the secondary solution. Then, you know, all the right patient name, patient drug, etc., time. Allergies. At point number 3, where it says verify IV access, it's going to be fine for you to say, this is my patient, and I know that the IV access exists. There will be another point in the demo. It'll actually be at step 14 or 15 where you're in the room, and you'll check again for patency of the IV site. But for the purposes of entering into the med room, you can verbalize that you're aware that your patient has IV access, and then you'll assess it again when you go into the room. So then you're checking, you can verbalize that you know that your IV primary solution and your IV secondary solution are compatible. You will have checked that already in your med book. Part of your planning is knowing what you're going to teach your patient. Actually, for the purposes of this video, I mostly just want to show you the physical piece of going through this demo. It will have been during your lab class when you would have gotten the instruction regarding the medications, different types of IV solutions, and the antibiotic piggyback medication that you're going to be administering. So just know that yes, you have to do all that, but the purpose of my little video here right now is not to show you how to do all that. So you're assembling your equipment. We're going to have our MAR. We're going to have our solutions. I'm reaching across here. What you'll have to do is, based on the order, reach in and grab the correct primary solution and the correct secondary solution. So we have these items here. Then what we also need are the proper tubings. You need a primary tubing and a secondary tubing. You'll need a timing strip or tape that you can mark on to sort of eyeball, and we'll explain that in class, so I'm just pointing out what you need. And then you're going to need a label for the tubing, a date label, when it needs to be changed. So we perform our hand hygiene, and we, of course, prepare our medication for one patient at a time. We compare, just as always, we compare our MAR to our tubing, or to our solution, and we select the right one. We compare our MAR to our second solution, and we get the right one. Then we can set the MAR away, and then we, actually we can't set it away, sorry. We have to do our second and third checks. But for the purposes of this, as I said before, I'm just showing you the mechanics of what you have to do with the tubings and the solutions. Okay, moving on. You've done all these things. What you have to do in this little med room area of the return is to spike your primary solution and prime it, and spike your secondary solution and prime it. So you're going to inspect your solution, hold it up to the light, you're looking for little particles. You're going to see if it's the right thing. You're going to take a look at the expiration date. You're going to check it for patency. If there were to be a lot of water in this bag, you would realize that this has probably got a hole in it. But this looks to be fine. So we're going to open it up, take it out, take another quick look at the light. I don't see any particles in there. And I'm going to hang it over here, getting it ready to be spiked and primed. And I have my secondary solution. There will be several types of these in the drawer, so be sure that you're choosing the proper dose for your patient. And you hang that, getting that one ready to be primed. You take a look at your primary tubing. Looks good. It has an expiration date. There are no holes in the package. And so you open it. It opens just like a little zipper down the side. You can tear off the extra wrapper. Toss that in there. Now keep in mind, the outside of this won't remain sterile, but the inside of it is sterile. People's bloodstreams are sterile, and this medication will be running into a person's bloodstream. So you want to untangle your tubing. Before you do anything, you want to make sure that your slide clamp and your roller clamp are close up here. And you want it to be closed. If you spike your bag with your roller clamp open, the fluid will run all the way through. You'll have all kinds of bubbles. It will make a mess and it will waste your medication. So it's clamped. The roller clamp is on. What we will do now is uncork or unplug our bag like so. And while we're holding that, we'll take the spike out of its holder without touching it against anything and carefully insert it into the port on the primary. And we roll that in to position. Then you'll notice on the chamber that there's a little T, and that the top of the T is to where you want to prime the solution. 1 pinch, maybe 1 1/4 pinches is all it will take. You can dispose of that cap. And remember, for the purposes of this demo, we're priming it into the garbage can. So then what you will do, your instructor may show you various ways of inverting these ports so that the air doesn't get in there, and I'm going to leave that up to each individual instructor. For your purposes, you just, in the demo, you want to do it properly. You want to go slow. You want to invert each port as the fluid passes by. Some people loop this around and invert all 3 at one time. I'm just going to show you how to do it this way. We're watching the chamber here as I begin to unroll this clamp, and it will start to roll. You don't want to just open this wide and let it go. You want to go very slowly. And you want, as the fluid passes by each of these ports, secondary ports, you want to invert the port. So here comes, I'm going to bring this port kind of up close so you might see both at the same time. The fluid should start to run as this roller clamp opens. See, here comes the fluid. And then it's going to go past that port. And then you watch your fluid level. I don't know if we can follow this. We want our ports to be inverted as the fluid comes by. Here comes our fluid level here. Got to keep this down or it won't run. We prime our tubing, and here it goes some more, looping its way through. You see the dripping happening here. This port is upside down, and then we've got another port that's going to need to stay upside down while the fluid comes through. Here it comes. And that has pushed all the air all the way out to the end, and then we clamp it. So we haven't even really let any fluid run through, we've just primed it. Then we can set the primary aside, and we do the same thing with our secondary. The difference between the primary and the secondary, at least one of the differences is, the secondary is shorter. Secondary has some additional equipment here. Do this. The secondary has a, I'm not even sure what we call this. What do they call it? They call it a hanger. How about that? A hanger. So we'll put that there for now. There's no sliding clamp on the secondary either. So we want to bring this up as far as we can, pretty close to the top, and clamp it completely closed, just like we did with the primary. We've still got our protective cap on the spike. We've still got a protective cap on the other end. Now what you're going to need to do is this